Singapore will be able to conduct 40,000 daily tests for coronavirus by later this year. The government is aiming to catch as many infections as it can while gradually easing restrictions. The nationwide testing strategy is also being developed to allow for better detection of unlinked cases.
Singapore has conducted 140,000 tests for COVID-19 so far, which translates to about 2,500 tests per 100,000 people. It's already among the highest testing rates in the world, but authorities hope to expand this even more.
Currently, we have the capacity to conduct more than 8,000 PCR tests a day in total across our community and migrant workers in the dormitories, up from 2,900 a day in early April. We are working with various private and public sector partners to progressively increase our testing capacity further to up to 40,000 a day.
Mr. Gan explained that the main test used now is the polymerase chain reaction or PCR test. It's the gold standard for detecting infection by picking up the virus from a nose or throat swab. Serological tests, which indicate a past infection, are also being done by the National Centre for Infectious Diseases to study the level of infections among specific groups, such as healthcare workers and their close contacts. A nationwide testing study is being developed in line with the higher testing capacity.
It will involve more extensive community surveillance so that we are better able to detect any unlinked cases in the community. We will also prioritize the testing of higher risk and more vulnerable groups.
Such selective testing is also being carried out on patients without symptoms.
We currently test asymptomatic young children if they are in the same household as COVID-19 patients, since they may not be able to articulate their symptoms well. And in that addition, a key priority is to protect vulnerable groups. This includes seniors, particularly nursing home residents.
Mr. Gan added that doing this for the entire population would not be effective, as there is no widespread community transmission, and therefore would not be the best use of testing resources. When asked by MP Leon Pereira if Singapore is testing sewage as a way to determine clusters, Mr. Gan said trials are in fact being done.
There are challenges because sewage by nature would have been significantly diluted. So we will need to test the sensitivity and see whether we are able to pick up sufficient fragments to be able to determine whether there is significant infection in particular target area. So it's something that we are studying, but it has its inherent challenges, and you may not be able to deploy it for all kinds of settings.
Countries like Switzerland and Australia have conducted such sewage and wastewater testing for the infection.